Welcome to Using Data to Understand Child Find Systems. This course is divided into two parts. In part one, we are going to provide an overview of child find and do some context setting. This portion focuses on the data that people probably think of most when they think of child find data, the 618 child count data and the APR indicator data. We are also going to talk about engaging key partners and interpreting data. In part two, we will follow the recommendation of the GAO report that was released in October 2023 and look at data beyond the federally reported data that could be useful in examining how child find systems are working. We'll talk about other data that Part C and Part B have that could be useful, such as data on referral sources and different ways of disaggregating the data, as well as data from outside Part C and Part B that can inform child find systems. These are our intended outcomes for part one, and also our agenda for this session. We have built in some reflection opportunities throughout the course where we hope you will pause and consider your data and practices. Let's dive into some basic information about Child Find. Child Find is the system for identifying, screening, referring, evaluating, and tracking children who may be eligible for early intervention or early childhood special education. While both Part C and Part B contain explicit requirements for states related to child find, these systems include all the people and practices involved in locating potentially eligible children and families. Child find is not a point-in-time activity. While programs, districts, or communities may hold screening events intended to identify children who may be eligible en masse, child find practices should be ongoing. We're going to talk a lot about how child find data is more than just the child count that's reported to OSEP. There's a lot of potential data that can inform your child find systems. Child find systems rely on critical connections between Part C and Part B programs and other entities to ensure they reach all children and families. These are just some of the connections to facilitate those partnerships rather than an exhaustive list. Here are some of the Part C requirements related to child find. Note this is not an exhaustive list of all the requirements, it's some highlights. Referrals may be based on the results of a screening, pre-referral screening, and any referral source may refer a child to Part C. The most common referral sources are physicians and families. States have the option to conduct post-referral screening. If they do, that screening must occur with parental consent within the 45-day timeline from referral to IFSP meeting. States also define their eligibility criteria, which can fall in the categories of developmental delay or diagnosed or established conditions. States also have the option to make children eligible via at-risk conditions. The State Interagency Coordinating Council also supports child find for Part C. Here we see some highlights from the requirements related to Part B preschool programs. For Part B, referrals are initiated primarily by families, although they may also come from other community programs. This is in contrast to Part C referrals, where the most common referral sources are physicians and families. Eligibility is determined through an evaluation and the IEP team, where based on the evaluation, the team determines whether or not a child exhibits a delay or disability and is in need of special education and/or related services. States define their own eligibility criteria, which may include developmental delay, in addition to other disability categories. Part B also has a required timeline of 60 days or fewer if the state wants to establish a different timeline, from initial parental consent to evaluation. Additionally, Part B requires a state advisory council of key partners, including families, similar to the state ICC required by Part C. As stated earlier, both Part C and Part B define their own eligibility criteria. For Part C, developmental delay may be defined using multiple criteria. Criteria are often expressed in a percentage of delay or number of standard deviations below the mean on standardized assessments. For example, the criteria might be a 30% delay in one area of development or 20% delay in each of two areas of development. States also define criteria for eligibility based on diagnosed condition. Some states use the language that is in the regulations, while others include more detail or a list of conditions. Additionally, states have the option to define and serve children who are considered at risk. currently 6 states and 1 territory serve children considered at risk. For Part B 619, states define the age range and criteria for developmental delay, which can be used for any subset of the 3 to 9 age range. From the last state preschool survey, we learned that 31 of 49 respondent states use standard scores for determining developmental delay. Similar to Part C, category for diagnosed conditions, children can also qualify for preschool special education based on specific disabilities listed here. The difference is that they must also have an identified need for special education and/or related services. As you can imagine, eligibility definitions vary widely across states. Some have very broad eligibility and some have more narrow eligibility. These criteria do not necessarily correlate to the proportion of children served, however. There is more going on that impacts the number of children served than the eligibility criteria. This is why it's so important to look deeper into your child find data and efforts. There are many reasons for focusing on child find data. Strong evidence demonstrates that the earlier children are identified and served, the better the outcomes for the child and family. There are groups of children residing in communities that are less likely to be identified, located, and evaluated, and looking at your data can help you identify where those gaps are. Data suggests that comprehensive child find systems are not being implemented as effectively as they should. Child find data can also contribute to program planning, as you identify where you may need to strengthen aspects of your child find system and areas of the state where you may find more children with increased outreach. This may help you understand where you may need to shift resources. Focusing on child find data can also help you improve outcomes for the program and for individual children and families. So when we focus on child find data and trying to really understand what is happening within the child find system, we have many opportunities to strengthen child find. With this information, we can develop more efficient systems to better improve earlier identification. We can close gaps on integrating early identification systems within states and local communities. Remember, these efforts rely on those critical connections to be truly comprehensive. We can reduce gaps in data that track from concerns to referral, evaluation, and services to help us understand the pathways that children and families take. We can also combine developmental monitoring and screening systems to increase earlier identification and more timely, more appropriate referrals. Now we're going to talk through what Part C and Part B 619 are required to report related to child find, including some examples for both C and 619. Before we jump into the reporting requirements, take a minute to reflect on how you are using your federally reported child find data, your 618 data, or your APR indicator data on child find. For example, do you provide child count data to local programs? Do you discuss the data at the state level? Do you access the national data files to look at how your state compares to other states? Do you look at your disaggregated state data? Or if you don't use it specifically for child find yet, have you looked at the 618 data files or indicator data to see how your state is doing? Pause this recording and reflect on this for a few minutes. Here's an overview of the required data we'll be discussing in more detail. What we refer to as the 618 data collection is authorized under Section 618 of IDEA. 618 requires Part C and Part B state agencies report on several required data collections, with child count or number of children served by Part C and Part B being among them. OSEP compiles the state's data into their data products, which can be accessed on the links provided here. Both Part C and Part B also have required APR indicators that are labeled child find indicators. The Part C child find indicators focus on percent served, while the Part B indicator focuses on timely evaluations. For Part B, we will mainly be focusing on the 618 data. First up, let's look at what Part C reports under 618. Part C programs identify a date between October 1st and December 1st, often referred to as their census date, and report point-in-time unduplicated counts of the children enrolled on that day, broken down in a number of ways. The number of children by setting by age, by setting by race ethnicity, and count by gender. If the state opts to serve children at risk, they also provide the number of children served who are at risk. In addition, states also report a cumulative count of children served by race, ethnicity, and gender for the most recent 12-month period. This count will include all children served throughout that 12-month period, as opposed to just those served on that census date. Here's a look at the most recent national data summarizing states' Part C 618 data. We can see the total number of infants and toddlers served and the percentage served by age group. In the chart to the right, each bar represents a state, and we see the birth to 3% served by state, ranging from 1.58% to 10.82%, with an average of 4.2%. This is an example of what we can learn from the national 618 data. So within your state, you could think about disaggregating the data similarly in ways that are meaningful to you. This example used the child count and settings table, Table 4. Here's an example of a state 618 data table displaying child count and settings by age. Here we can see the age groups broken down into one-year bands and categorized by the settings in which children and families receive the majority of their services. However, if we're interested in child find, we may want to focus on the age information so we can see how they are doing with enrolling children as early as possible. So here we can simplify the table, so we're only looking at age group, total children enrolled, and percentage. Let's pause for a moment. What are your impressions based on these data? The cumulative count will always be higher than the point in time count because children and families come and go throughout the year. The 22-23 cumulative count was not available, so here we're looking at the 2022-23 count. Now shifting to the 618 data that Part B reports for preschool. Similar to Part C, Part B selects a date for the point in time count between October 1st and December 1st. And for preschoolers, they report education environments data for early childhood, ages 3 to 5, not in kindergarten. Here we are looking at the most recent national data for Part B, 2022-23. Part B also reports on the number of children each age, ages 3 through 21, who receive Part B services. The 618 data tables for child count by age do not differentiate between 5-year-olds in kindergarten and not in kindergarten, which is why here you see the percentage of 5-year-olds served by Part B includes 5-year-olds in kindergarten. However, the data tables for educational environments do differentiate between 5-year-olds in kindergarten and not in kindergarten. So we can see that a total of 535,392 children ages 3 through 5, not in kindergarten, received Part B preschool services in 2022-23. The national percentage of the population served was 4.64%, and you can see that the variation in percentage served is quite large, from 2.25% to 12.07%. You can also see that the percentage served increases with age. Similar to with Part C, these ways of disaggregating data by age and by LEA to look at variation could be useful in beginning to understand a bit more about what is happening in your state related to child find. Here's an example of one of the Part B 618 state data tables associated with child count in educational environments, showing child count by race, ethnicity, and disability. From this one chart, you can get a lot of information about the makeup of the children in your program. You might look just at your race ethnicity data and the percentage of children of each race ethnicity enrolled in the program. You might do the same for children of each disability category. This data can provide information related to significant disproportionality. How else might you use this information, or have you used this information in your state? Let's shift to the APR indicators. Part C has 2 child find indicators, indicators 5 and 6, that are both results indicators, so states set their own targets. Indicator 5 is the percent of infants and toddlers birth to 1 with IFSPs, and indicator 6 is the percent of infants and toddlers birth to 3 with IFSPs. These are often referred to as percent served. The data come from the 618 data collection, and the measurement calculation is the same for these 2 indicators. The percentage equals the number of infants either 0 to 1 or 0 to 3 with IFSPs served by the Part C program divided by the population of infants and toddlers, either 0 to 1 or 0 to 3 times 100. Here's an example of how that looks. As shown in the top chart, the APR pre-populates data from the 618 submission, the number of infants and toddlers 0 to 1 with IFSPs, and census data, population of 0 to 1. The bottom chart carries those numbers down to the SPP APR data, showing the previous year's data, the current year's target, and the current year's data, the status, and whether there was slippage. In this example, the state did not meet their target and there was slippage. Let's move on to think about how and why to engage key partners in your interpretation of child find data. Pause to reflect for a moment on how you currently engage with key partners around your child find 618 or APR data. Consider key partners including local programs or LEAs, families, referral sources, advisory councils, and the ICC, among others. Why is it important to engage key partners in examining child find data? As we've discussed, child find systems are complex and involve collaboration with numerous entities to ensure a comprehensive system. Not to mention, they must also function around the state. By engaging key partners in your efforts to examine your child find systems, you can gain more perspectives on how things are working on the ground. When you include key partners with experience from all aspects of the child find process, such as referral sources, outreach partners, those attempting to access services, we can gain a more complete picture of what is working for whom, possible issues, and opportunities to address those issues. It is also important to keep in mind that each of these things may vary across different communities within the state. So who should you involve in the data analysis and interpretation process? Engage first with local program staff in Part C and LEAs for Part B 619, as well as families that you already engage as key partners. Walk them through the data, ask about how they interpret the results, then ask them who else to involve in digging into the data to identify areas for improvement. This could include other primary referral sources such as physicians, health department staff, parent center staff, Department of Social Services, and others. As we wrap up Part 1, so far we have looked at 618 and APR data as a starting point for thinking about child find and the partners you might engage in the discussion. Now think about other data you might examine to investigate the story behind the enrollment data so you can understand more about how the child find process is working. Take a few minutes to pause and reflect on these questions. First, think about data that Part C or Part B program collects that is not reported as part of 618 or APR data, but that could be useful in examining child find. This might include data such as referral source, outcome of the referral, reason for decline, evaluation date, or eligibility category. Are you using any of these data to examine child find? Next, think about other data that might be available that could be used to examine child find efforts, like data from key partners or from the child find self-assessment. For example, you might look at data from social services on county-by-county involvement of infants and toddlers in cases of substantiated abuse and neglect in conjunction with Part C data on captive referrals. Are you currently using any data not collected by Part C or Part B program to examine child find? In Part 2, we will discuss data beyond your federally reported data that may be useful in digging deeper in how your child find system is working. To wrap up, let's summarize some takeaways. First, effective child find systems rely on critical partnerships with local programs, LEAs, and cross-sector partners to ensure all potentially eligible children are identified, located, referred, and evaluated. Part C and Part B programs cannot do this on their own. Next, federally reported child find data provide some insight but tell a limited story about how child find systems are working. Finally, engaging key partners in analyzing and interpreting data is important for really understanding what's happening. Here are a few resources to support your work engaging key partners in your data efforts. In Part 2, we will be focusing on identifying and using data to dig deeper into how your child find system is working across the state. We're moving on from thinking about just federally reported data to thinking about other data that may be useful. By the end of this presentation, you should be knowledgeable about purposes of digging deeper into your child find data, sources of data other than the federally reported 618 and APR data that can provide insight into how your child find system is working, and strategies for disaggregating data to answer questions about your child find system. As we discussed in part 1, child find systems are complex and really rely on cross-sector collaboration for all of those activities related to identification, location, screening, referral, evaluation, eligibility determination, and enrollment. However, the data states report related to child find is really limited. The 2023 Government Accountability Office report highlighted the promise of additional data states may already collect for shining light on how child find systems are working. The report also renewed OSEP's focus on the child find data. And since the release of the report, we have heard OSEP asking a lot more questions about child find and child find data, and it has been added to an area of focus for DMS. Most recently, OSEP updated the Part C APR template for states to add information about results of root cause analysis related to child find indicators, C5 and C6, and required that states reporting slippage discuss the results of the root cause analysis in their APR. We know that states vary widely in what they collect at the state and local level, particularly prior to children's enrollment in the program, and how these data are structured. This is going to impact how you will be able to dig into your data. To give a bit more background about that GAO report, the GAO was tasked by Congress with reviewing barriers states face in carrying out IDEA requirements and any inequities in access to early intervention services. They carried out a number of activities in compiling the report, including surveying Part C lead agencies, from which they received 54 responses from states and territories. Unsurprisingly, they identified physicians and other healthcare providers as the most common referral source, followed by families. They also found variation in how children progress through the process from referral to evaluation to enrollment by race ethnicity. They found notable variation at different points in the enrollment process. For example, the percentage of children referred who received an evaluation ranged from 59% of American Indian or Alaska Native children to 86% of Asian children, a 27-point spread, whereas the percentage of children deemed eligible who enrolled ranged from 91% of American Indian or Alaska Native children to 95% of Asian and white children, a 4-point spread. The report found that the percent of children referred who enroll in the program varied widely by state, from 28 to 90%, with an average of 53%, as shown in the chart. As discussed in Part 1, the Part C data collections for child find focus on children who are already enrolled, and IDEA does not currently grant the Department of Education the authority to require states to collect and report data on children prior to enrollment that would provide more information about those who are referred, evaluated, and found eligible for services. However, since many states do collect and maintain data on children prior to enrollment, GAO and the department recommend states use the data they already have to examine whether disparities in access to early intervention services exist at steps prior to enrollment. There are numerous ways in which states can disaggregate their data to examine potential issues in access and to understand better how the child find system is working for children and families across the state. Also, while the GAO report focuses on Part C, we also know that Part B could benefit from this type of in-depth look into available data to examine ways to promote earlier access to preschool special education. The bottom line is that digging into your pre-enrollment data can help programs examine access to early intervention. It can also shed light on why you might not be reaching targets. You might want to look at differences in access related to geographic area, primary household language, age, disability, race, ethnicity, local program or LEA, referral sources. What else? If population data are available for comparison, you may also be able to look at who is missing from the program. In other words, based on the population data, who would you expect to be referred or enrolled versus who actually is? Note that these comparisons to the general population may be done at the state, regional, or local level. We often see that there is a lot of local variation that washes out when you roll up to the state level. So it's really important that you do work with your programs to dig into more local data to see who might be missing. This data on subgroups of children pre-enrollment allows you to begin to look more closely at practices, policies, and structures that may contribute to differences. But quantitative data alone may not tell the whole story. This is where engaging your key partners can really be helpful in further digging into what's happening. A combination of quantitative and qualitative data may be most useful for really understanding your child find system and how it's working. Here are a few examples of the types of quantitative and qualitative data you might have or collect. For quantitative data, examples of data collected by Part C or Part B include race, ethnicity, referral source, eligibility category, age at referral, geographic location, referral outcome, Part C to Part B transition data. Population data and demographics might include census data, birth rates, local demographics, and data collected by key partners. For Part B, that could be data shared from Part C as part of data sharing agreements to support transition. It could also be the EDI data or data from DSS on children in cases of substantiated abuse and neglect that could be referred under CAPTA. What about qualitative data? Using a tool like the Child Find Self-Assessment for mapping your Child Find system can be helpful for understanding how your key collaborative partners support Child Find activities across the state and in local communities. Hearing from families about their experiences seeking services can also be helpful for understanding where breakdowns may be happening. Feedback from key partners, including referral sources, can also shed light on some of those practices, policies, and structures that may need clarification or updating, or may highlight where outreach is still needed. Take a few minutes to pause and reflect on the data that are collected in your state that might be useful to use to examine your Child Find system. These could be data that are collected at the state or the local level. Consider specific data elements you have in your data system that could help you drill down into how the Child Find system is working. These are just a few examples of how you might want to dig into your Child Find data. What other ideas do you have? How you want to dig into your data impact how you will disaggregate your data. So let's talk about that. How you disaggregate is initially dependent on the data points you have in your system, and as always should be done in collaboration with key partners, including program staff and families at the least, plus representatives from other early childhood serving partners in the state or community. There are nearly endless ways to disaggregate your data. To start, let's think about disaggregating by a single variable, such as these examples. Here is an example of referrals disaggregated by one variable, region. The table shows the number of children referred by region, and the chart shows the percentage breakdown. You can also further dig into and disaggregate your data by running cross-tabulations of two variables, for example, by looking at race ethnicity by referral source or eligibility category by home language. You could do this at the state level or at the local program or LEA level. Let's look at an example. Here we are looking at referrals across the state by region and age. Without any context, this probably raises more questions than it answers, so we won't focus here on interpretations of the data. Instead, you might think about those questions that it does raise for you and what you would want to know about the regions, about the population of children and families in those regions, and so forth, that would be necessary to have access to as you're digging into your own data. Now we're going to walk through an example where we disaggregate by referral source, then by referral closure reason, then where we cross-tabulate referral source by referral closure reason. First, let's look at an example of referrals disaggregated by referral sources. Here we see that physicians are the source of most referrals, followed by social services, then parents. We can also see that childcare accounts for a very small proportion of referrals, just 1%. Pause and reflect for a minute. What are your impressions based on these data? Now let's look at referrals disaggregated by referral closure reason. Here we see that 23% of referrals end with attempts to contact unsuccessful. For 21% of referrals, the parent declined the eligibility determination. For 6%, an evaluation was completed, but the child was not eligible. For 7% of referrals, the child was found eligible, but the parent declined. 22% of referrals ended with the child getting an IFSP, and 21% of referrals were late referrals. What are your impressions? What stands out to you in regards to what is or isn't working? Now let's take those examples of referrals by source and referrals by closure reason a step further and look at the referral closure reasons by referral source. First, let's zero in on physician referrals and their closure reasons. We see that physician referrals account for more than half of all referrals, 1,027 total referrals, and in the pie chart we can see the percentage of each referral outcome. What jumps out to you here? Take a minute to pause and reflect on what you see. Another way we might want to dig into these data is to see how each of our referral sources are contributing to a given referral closure reason. Let's dig into the referrals ending with unable to contact, where a referral is made but the family never picks up the phone or you're otherwise not able to get in touch with the family. So how is each of our referral sources contributing to those 456 attempts to contact unsuccessful? In looking at the data table and the pie chart, physicians account for the largest proportion of attempts to contact unsuccessful, 48%. Physician referrals account for about 51% of referrals overall, with that 1,027 divided by 2,000. So we may consider this a proportionate number of referrals ending this way. For other referral sources, we see unable to contact with 20% of parent referrals, 19% of social services referrals, 8% of hospital or NICU referrals, and 1% of child care referrals, and 4% of other referrals. Take a few minutes here to reflect on the analysis we just reviewed. What do you think about this way of looking at your data? Does it seem helpful? Who would it be helpful to include in conversations about the data to gain insight into why the data look the way they do? How might you use this type of an approach with different variables to understand what's happening? What kind of experiences do you have with digging into your data into referral sources? Keep in mind that when you don't have data for questions you want to answer, you may have to regroup, which could mean changing your questions or figuring out if there is some other way to get the data you need. This might include thinking about the data you may not have at the state level, but that may be housed at the local level. To summarize the takeaways from Part 2, digging deeper into pre-enrollment data can help your program examine differences in access to early intervention. It can also help you hone in on root causes related to your indicators C5 and C6 data. A combination of quantitative and qualitative data may be most helpful for understanding what's happening. The qualitative data can tell the story behind the numbers. There are so many different ways you can disaggregate your data to answer key questions that are important to you and to your key partners. And keep in mind that it will be useful to look at these data at the local level as well as the state level to see how things are working across the state. Here are a few TA resources that can support your exploration of quantitative and qualitative data and engaging key partners with the data. To wrap up, we'll just repeat these points we discussed in Part 1 and Part 2. There are numerous data points that can provide insight into different aspects of your child find system. A mix of quantitative and qualitative data can provide the most complete picture. Engaging a varied group of key partners and interpreting data is critical to ensuring multiple perspectives on the data and on child find practices are considered. Thank you, and please reach out if you have any questions or would like some technical assistance in follow-up to this presentation.